CLL is a form of indolent B-cell lymphoma, and it is the most common leukemia that we usually see in the clinic in Western Europe and in the US. And it's basically a disease that arises from mature B cells that, due to various genetic defects, have uncontrolled proliferation. And it is a very heterogeneous disease. So we know a lot of patients, or the majority of patients actually, when they have the diagnosis of CLL, they are usually without symptoms, and it is usually just discovered by accident in a standard blood count that there are increased lymphocyte values, and the further workup of these findings usually leads then to the diagnosis of CLL. And usually the disease has a very indolent course. So usually throughout a couple of years, the patients do not have any symptoms. Usually when the patients are followed up, one observes that the lymphocytes might increase steadily, or that lymph nodes might enlarge steadily, but the disease usually at the beginning doesn't show barely any symptoms. So what we then later see is, once symptoms that are typical for lymphoma develop, meaning B symptoms with fever, with weight loss, with night sweats, with recurrent infections, with fatigue, these unspecific symptoms of lymphoma, and these occur, usually an indication for treatment initiation rises. And additionally, we also see in later stage CLL that the blood count shifts regarding on the one hand, of course, the lymphocytes, they can steadily increase, but the lymphocytes themselves do not necessarily mean that patients need to be treated. We know that patients can be without any treatment and without any complaints, with lymphocyte counts of 50 or 60,000 without any issues. What becomes more of an issue is when we see that the anemia develops and the platelet count drops, both signs of progressive bone marrow failure due to the heavy infiltration by the malignant disease. And therefore, these are the typical patients that require treatment. And these are, at the end, the patients that we particularly study, because in this group of patients, we try to improve treatment and treatment outcomes. And this group of patients has been the particular focus of all the research and the latest efforts to improve the outcome of these patients, meaning better response to treatments, deeper remissions, longer time until disease relapse, and ultimately better quality of life. So this is, so to speak, the current situation when it comes to CLL.